Welcome to CareTalk, America's home for incisive debate about healthcare, business, and policy. I'm David Williams, president of Health Business Group.
And I'm John Driscoll, the CEO of CareCentrix.
John, it was only a month ago that we talked about whether schools would reopen and if they would stay open. And it was
What a mess.
yeah. And, John, it was basically we decided it was sort of wishful thinking and that basically all the choices were bad. That's the mess, as long as the pandemic was raging. But hey, a month is a long time. Now we got some real examples to talk about. What are we seeing?
Well, David, you were the big fan of opening up under all circumstances, and I just really wonder whether you want to rethink that. I mean, come on.
Well, John, a lot of the colleges have opened up, although I saw from the Chronicle of Higher Education, only 2% are fully in person. And
wait. Which, of course, means that the rest are giving everybody a big break on fees, right?
Well, they are, John, in a certain sense, which is that some of them are actually charging extra COVID fees for all the testing and stuff. I'm serious.
You don't think that the millions of people who have been put in debt by the ridiculously high and unreasonably high costs of college and education, that they're adding more fees on top of the requirement that the students don't show up for class? I mean, come on, give me a break. That can't be true.
Yeah, well, there's a few schools that are doing it. I guess the counter argument, John, is that maybe they should give a tuition refund, but they could just charge the COVID fees because they actually are doing the testing.
Well, I do think that doing the testing matters. I'm involved a little bit through Testing for America in helping the HBCU, the historically Black colleges and universities, think this through. And you can certainly and those vulnerable institutions, which are essential U.S. institutions to make sure we continue to provide access to folks who've typically not had access, folks of color, to secondary and tertiary education, those schools are thinly capitalized. In some cases, their annual budget is about equal to their endowment. And what we have found is with access to next generation testing, plus the right protocols, plus the right organizational setup in the schools, at least in the first school we're working with Delaware State, you actually can do it, but it is a complex set of chores because you're also you have to have not just the testing and the tracing, but also the containment if someone tests positive. But I think it's sort of appalling that all of these other schools are charging full freight and providing very little access to the traditional college experience. But tell me how it's going at other schools, David.
Well, John, it's a lot of schools have tried their best, and even ones with plenty of capital are not doing that well. So you've had some that have had big outbreaks even before classes. You look at University of Alabama, 1,000 students testing positive. University of North Carolina, they had to shift to online classes after some big back-to-school parties got out of control. And I think most telling of all is perhaps the University of Illinois Champaign-Urbana. They had a kind of Manhattan project.
Slow it down. Slow it down. Wait.
What?
Of course there are going to be COVID outbreaks. These are young kids that are going to socialize. I mean, that's part of the whole college experience. I mean, of course there are. I mean, I think you're kind of being a little bit unreasonable here.
Well, John, the thing is, I never said I was reasonable. I'm not sure that was ever one of my arguments. But I think if you could look at it from a mathematical standpoint, right, which is asymptomatic transmission plus a highly infectious disease plus something that mostly doesn't cause heavy sickness in young people, that equals big trouble. And you add some accelerants like drugs and alcohol, and no wonder we have some problems.
Well, but I think, to be fair, the colleges are a little bit. Forget the fact that the average ridiculously high private college tuition is clocking in at about $37,000 a year, and like 2% are in person. And I mean, I guess it's fine. It's $26,000 in a public college, but I mean, come on, it's insane that colleges are still charging so much. But stepping back, the colleges are just experiencing what all of us are going to experience, which is that if you don't have testing, tracing, containment, and some amount of follow through, you will have an infection that just rages. But if you can set up that regime, I actually think the colleges could open and have classes as long as they're testing on a regular basis and they've got places to contain and frankly care for those who are COVID positive. I mean, this is solvable. I mean, look, why can't colleges do as well as Singapore, Taiwan, and New Zealand by using the same techniques. And the great thing is it's a contained environment. Everybody's using their key card to register. You could actually do tracing. I mean, I'm sort of surprised that you're seeing this as a failure. I think it could be a success.
John, some are doing well, and what you see is schools that have taken it very seriously, having testing upon entry, and in some places they have to test again and test negative 3 times before people can start off. I heard one mom of a daughter going to college, and she said she never thought she would tell her daughter this going to college, but she said, "Honey, stay negative."
You're kind of funny, but that actually was really, really, really weak. You're finally agreeing with me that it isn't a disaster, even though it was your idea that everything be open, that it can work, but
Let me
it
ask.
just needs to be managed.
I'll ask you. So the reason that the schools can't do what Singapore and Korea are doing is because they're not in Singapore and Korea. They're in places where the virus is raging, and the biggest single impact is really going to be what's the level of community prevalence of the virus.
Oh, stop using these big phrases. I mean, the infection was raging in a lot of these places, and it got contained because it was managed, because there was I mean, David, Senegal has access to tests that are with results available within a day. They separate treatment so that folks who have COVID are not with everyone else, and they've got clear tracing. If Senegal can get it right, why can't the United States of America? I mean, come on.
So, John, I guess I should stop using all these big words since nobody's going to be getting a college education anymore. I'll have to dumb it down for the audience as they go through. Now, we do see some good, some colleges that are doing a good job, and also that are trying to be transparent. So you see these dashboards. The State Universities of New York just announced a dashboard this week, provide some transparency on what kind of statistics they have on campus. Some private schools are doing it. I know Wesleyan is doing it. BU, Boston University, has it as well. Sometimes it raises other questions, though. So at Boston University, they're saying they're aiming for the prevalence level of COVID in their community. Well, Boston has a kind of high level relative to some of the surrounding towns like Brookline. So there's questions that come up even with the transparency.
But David, to double click on that, what does that actually mean?
Yeah, so John, it means that because the virus is so unknown and novel, you could put more information out there, but you really can't plan ahead. You can't plan beyond a couple of weeks. You still need some luck, and you also have to work with the local community, and you have to have everything firing on the same path so that you're in sync with the local health department, the local folks in the community, and whatever's happening back home. John,
isn't it a little bit easier than that? Isn't the bottom line that if we can actually track everyone and test everyone and get the results quickly, and then care for and quarantine those who get sick, that we could stop it in a college or a community? I get the fact that whether it's Boston or Charlottesville, that a lot of the communities around these colleges know that they're going to be made more at risk because the students are there, but they're also getting the advantage, I guess, of the economics. But it's more a question of, do you have the right test access and regime? Do you have the right protocols for either geographic or personal containment? I mean, I saw in Colorado that they had the Colorado college, they had some positive tests, and they just quarantined the dorms. I think that you're now seeing that, again, testing is really the key here. That you can actually, through testing wastewater immediately, but wastewater testing of poop is actually a way to do natural pooling testing. And those tests are, I mean, Yale is doing it. Other communities are doing it. Other schools are doing it. I mean, this is manageable. We just have to be honest about what the requirements are and then execute on it. Again, to your point, with the public health authorities, I think there's a little bit of learned helplessness that's being led by the White House. And you look at other examples. Again, if you don't like Asia, I'll take you to Africa. If you don't like Africa, I'll take you to parts of Europe. This is a manageable, not a solvable problem until we get a vaccine, but a manageable problem if we just take the right steps.
Well, John, I know you're not that comfortable, talking about college due to your level of attainment. So let's go back to let's regress to high school. And do you see any differences?
I was even worse in high school, but getting to the point, I hated high school. You probably enjoyed it because you're more wonky than I am. But I think that the challenge for high schools and elementary schools. And I do think there's a huge social cost of not going back to school. So I think there is some benefit in what you're talking about. But we've had a lot of time to prepare the PPP, the plexiglass, the hybrid schedules. And it feels like all of this is happening rather last minute. And I still think we don't have enough support of to your point, leadership in public health and access to testing. I mean, honestly, every child in America, every parent in America whose kid's going to school should be able to ask for, do the kids in my kid's school have access to rapid testing? Is the staff rapid testing? What's the protocol? And frankly, how are you handling what we're now seeing, which is that indoor versus outdoor spread? How are you organizing the actual layout of these schools to make sure that there's as little spread as possible? And do we all have access to tests? And if we don't, why not? Because the tests are available in other parts of the world and they're managing this better.
So, John, I think that high school actually and elementary school have some notable differences from colleges. So one is the kids can be told what to do, but they're living with their families. And so there's actually more exposures and it's harder.
Do you really think that your kids pay attention to you?
I didn't, that's always the exception that proves the rule. John, I have a little, if you'll be patient for a second, I'll tell you about a little prank that I liked that didn't happen in our day. But, the kids are living with their families. So there's more exposures. It's harder to make testing work. Now, actually, when you're in high school, you're actually in the classroom. Like you're actually in the classroom a lot of hours a day, unlike college where it might be an hour or two a day. And they got some old lousy buildings. Now, the prank I wanted to tell you about, John, was that there was a teen in Florida.
Is this a short story?
Yeah. There was a teen in Florida and he got busted for doing a distributed denial of service attack that shut down the remote learning of his school. So he didn't even have to pull the fire alarm or phone in a bomb threat. So there's progress, John.
That's a very weird, wonky joke. But I think I also think you're missing the point on elementary school. You're so old now, you've forgotten that. I mean, think about elementary school where these kids are running into each other. If you're thinking about preschool or first couple of grades, teachers often have to clear up the snot off of kids, help them kind of deal with certain aspects of life where they're intimately involved in kind of making sure the kids are healthy and feel secure. I think we've got to go back to school. I get that, but there should be a demand right now for the testing, the PPP, and the protocols to make sure folks are safe, because there will be community spread, there will be infections, but it doesn't have to be burdensome and destroy the school year. If we can just manage this as a public health problem, we can both open up the economy and run our schools. But we've got to cultivate and advocate for, I think, parents should demand better, and the path is clear. And I don't think if you tell kids, I mean, I've yet to been in an elementary school yard where if you tell the kids to do something, they all do it. I mean, I just think that's impractical. We have to deal with the reality here. But it goes back, David. The public education problem is really a derivative of the public health failure. I mean, don't you think?
I do, John. And here's what's happening. Some people are taking their kids out of public school and putting them in private school, and the private schools can enforce certain things that the public schools can't. And I think when they're really clear-eyed about what it takes, it means social distancing, really putting the desks apart. You can't approach one another or the teachers. No eating or drinking in school. You got to be outdoors for lunch, even when it's bad weather. You put your mask on, you only take it off on the break. You have an assigned seat on the bus with your mask on and your windows open. And you get you get a flu vaccine, it's mandatory. And then you throw out the people that don't conform.
Well, I think obviously the private schools have more options, but that worries me, because then you start to extend the class divide of the haves and the have-nots. The haves that can really throw a lot of money at a private school, and the private school, then I worry that you're basically isolating, lower class kids, middle class kids who don't have that option, and that's kind of scary. I don't know, David. I think you could. What's interesting is if you go back in history to the 1918 flu, which was the last great.
Yeah, just back when you were a kid, John. Yeah, I remember.
Yeah, the early days. They actually held classes even in the middle of winter in the Northeast. They held them outside.
Yeah.
So I don't know that we have yet gotten our arms around how bad this is, and how through somewhat uncomfortable and certainly unconventional methods, we could actually solve it, particularly if you add testing and tracing. But one thought, David, is to do much more of public school outside. People seem to have adapted in 1918, and it largely worked.
Well, that's good, John. Well, we're running out of time here, if not for the virus. But what's the way out of here? I mean, you talked about testing, contact tracing, and so on. But what's going on behind the scenes? I mean, vaccine, treatment, federal aid. I mean, how are we going to get out of this semester, next semester, whenever it may be?
This is a three-step problem. You've got to identify it as a public health emergency. There needs to be clear leadership and protocols from the feds. I mean, clearly there was more interest in the political opening of the schools than the practical planning for the opening of schools. And finally, we've got to, as consumers, as parents, and as voters, demand that we have access to the basics, that schools have access to the basics of frequent testing, access to transparent results, to your point, PPP, and a plan to make sure our kids are taken care of and can get educated, and not just one that creates solutions for the private schools and problems for the public schools. But it starts with acknowledging that public health emergency and owning it and leading it. Other countries have done it. We can do it. We just have to own it.
John, I don't disagree. And in fact, I think the parents that are pulling their kids out of public school are doing it for their own kids, but they don't think it's the right response at an overall level. Well, that's it for yet another edition of Care Talk, another cheery one, John, if I may say so. I'm David Williams, president of Health Business Group.
And I'm John Driscoll, the CEO of CareCentrix. Thanks for listening.